Hi everyone, it's Emma here from Emma Talks Teeth. Welcome back to my page. If you've not been here before, I'm Emma and I'm an oral health therapist and dental hygienist based in Melbourne, Australia. I help the general public with dentistry tips and dental clinicians if they want to elevate their patient experience. So if this helps you, don't forget to like and subscribe. So today I'm going to be talking about questions that you need to be asking before you go on a commission salary. Now, these are 10 questions that I've come up with over the years and my experiences, as well as input from other clinicians as well. So a commission-based structure is quite common among dentists, not so much so among dental hygienists and oral health therapists. Most of us are paid by the hour, but I remember when I was first offered a commission-based structure, I didn't know the questions to ask and I found it quite confusing, and I wish I had a little bit more insight into what it means to go on a commission structure and how to negotiate. So follow along and watch this video if you are thinking of moving on to commission, to see if it'll suit you and where you are in your experience, and if you've been offered a commission job as well. So question number one, what is the percentage? This is the most obvious one, but this question affects the next 9 and whether it's worth you actually considering taking a commission job based on your years of experience and what type of work you do as well. So for example, let's work off 30% commission. So 30% commission, I'm working off, for this example, a $250 standard hygiene appointment in private practice. So that is $75. And then you've got to subtract your tax. So most hygienists are in the 32.5% tax range in Australia. So 32.5% of $75 is $24, which leaves you with approximately $50 an hour. And that $50 figure is plus or minus superannuation depending on your contract. Number 2, are the books consistent? Are you taking over an existing clinician's appointment books, or is this a new role that they've created and it's going to be an overflow of patients that they can't fit into the current hygienist's book? So in a commission-based wage, no patients equals no earnings. So why this is an important question is because if your books aren't consistent, you aren't going to be earning money every hour of the day that you work. If I was being offered a commission-based role, I definitely would be asking what the appointment books look like. Don't be afraid to ask. It's your right to know exactly what you're walking into. For example, if it is a new role, is there enough patients to fill at least minimum 80% of your day? If you're sitting there with at least 2 or 3 gaps, that could be potentially 3 hours of your day that you're sitting there earning $0. So a really important question to ask is if the books are consistent, because if you're taking over an existing appointment book, you're more likely to have consistency that the previous clinician would have built up for you, and it would be easy for you to just slot right in and have consistent earnings. And if it's a new position that they've created for you, keep in mind if there are other hygienists within the practice that have been there for years, a lot of those patients may be quite used to seeing them. So this is another hurdle that you've got to jump over. You've really got to build rapport with patients who are used to seeing particular clinicians, and this may impact how your book grows and how long it will take to grow as well. Question 3 is about taxes. So do they take the tax out for you, or do you have to do that yourself? If they don't take it out for you, it's you who has to set aside that money out of every paycheck. So I temped for a little while in my career, and I set aside about 40% of those earnings in a separate bank account that I didn't touch. So when it came to seeing the tax man at the end of the year, I would have that money sitting there because that is money that you're owing to the government. So some practices take it out, some practices don't. Factor that in because you don't want to be left at the end of the year with a really big tax bill and you've got to dip into your savings where you might not have that money there. Super stressful. And you've also got to take into account accountant's fees as well. Question number 4, is it plus or minus superannuation? Now, this is a really big factor. So 10% is taken out of your wage that gets contributed to superannuation, which you can't touch until you retire here in Australia. Now, you will find employers will try to negotiate this with you. Some employers will say it is your commission wage plus super. Some will negotiate a commission wage which will include your super, which means it's minus 10% out of your earnings. So if we go back to my original example of 30% commission on a standard $250 appointment, that left you with $50 after tax was taken out. Now, if you subtract 10% from that wage, that brings you to $45 an hour, which, if you watch my previous video, is the benchmark in which I personally think, this is my 2 cents, that a new grad first year out of university should be earning. Question number 5, is my annual leave included or is that on top of my wage? So say you're on, again, we're going back to my original example, $50 an hour, and if that's minus super, that brings it to $45. And if it's minus annual leave, do you make, that 6 to 8 grand to make up for 4 weeks of annual leave that you want to take? For the 4 weeks of holidays, does it include sick leave, or will that come out of your earnings? Do they take a percentage out of your earnings to then pay you when you take sick days? So you can start to see by now that there are ways that employees will try to negotiate with you, and so this is why I'm making this video, so you guys can completely understand how you can negotiate and the different ways that you can play fair and come to a competitive agreement. Point number 6. Do you like my size 6 pictures? Sorry, that was a little bit cheesy. Number 6. What are the lab fees for mouth guards and whitening trays? So dentists get invoiced for crowns they make, any lab work that they send away, so the same would apply to you, so just double check what that arrangement would be and how much that is for you. Number 7. Are you still here? If you are, thank you for watching. Number 7, if there are any particular materials that you like to work with, for example, if you like to work with particular hand scalers or bonds or liners, will they pay that for you or will that come out of your own pocket? Number 8, teeth whitening. So how do they work that out for you? Do you get a percentage of the entire appointment, or whether they subtract the cost of the teeth whitening product? So for example, if you did a day of whitenings but they subtracted the cost of the teeth whitening product, that will affect your hourly rate. Number 9, do you have a CPD allowance? So with all the other factors that I've listed so far, a CPD allowance is something that you can negotiate as well. Some employees and dentists out there are really, really supportive of making sure that you do reach your 60 hours of CPD every cycle, or you may work for a dentist who does a lot of Invisalign and they would like you to go to courses. Will they pay for those courses for you? So these courses aren't cheap. CPD courses can be into the thousands, so if you can negotiate this into your package, then that's a great way for you also to get a benefit from a commission structure or even an hourly wage as well. Finally, number 10, do you have a DA? Do you have assistants? Now, this will depend on the job that you do. In an ideal world, I think all of us hygienists and oral health therapists can be in agreement that having a DA is ideal. You want help with all your changeovers, you want help with processing x-rays and letting the dentist know you're ready for an exam, you want help with suction. Now, each clinician to their own. There are some clinicians out there who are happy to do two-handed dentistry, and then on the other end of the spectrum, I know that there are OHTs and hygienists who will not work without an assistant. So it comes down at the end of the day to what you value in particular. Obviously, if you do a lot of therapy, it'll be almost impossible to work without a DA. And if you don't have a DA and you work a lot of hygiene, you've got to weigh up the other factors that aren't monetary. You've got to weigh up your posture. Whenever I walk past even dentists and hygienists, OHTs, surgeries who don't have a nurse, you know, everybody's hunched over like this, even with loops. So is that worth it to you? Over a long period of time, that does cause postural issues, neck pain, strain, so a lot of things to weigh up there. So guys, that brings me to the end of my video, the 10 questions that you should ask before going on a commission-based wage. Now, it's not all about the money, but you don't want to be taken for a ride either. So I really hope this helps you in your negotiations. Please share it with another OHT or hygienist that you think it will help. That's all for today. Thank you for watching. Please don't forget to like and subscribe. I will see you soon.